I want to analyze the latest developments of the coronavirus with Yahoo Finance's Anjali Kemlani and emergency room doctor Samson Davis, author of Living and Dying in Brick City. Good morning to you both, and thanks so much for being with us. Dr. Davis, I'm going to start with you. The Centers for Disease Control said yesterday it is not a question of if but when this virus makes itself known here in the U.S. in a larger way. They say it could lead to significant disruptions of daily life. What should we as Americans be bracing for?
This thing is all about precautions. We in the hospital are taking necessary precautions, face masks. We're screening all patients that arrive and travel with fevers, cough, symptoms of coronavirus. We have 57 documented cases. I think that number will rise, but at the same time, taking the necessary precautions is key. The same situations you would do for the flu, coughing into the crux of your elbow, making sure you quarantine yourself if you have fever, if you have children with fever, cough, keeping them home. I think it's most important to, at this stage, to treat it just as a simple, not as simple, but as the flu, in which we sort of isolate ourselves and quarantine ourselves when we're suffering from the flu itself.
Doctor, how are you testing patients? I know there was word of a coronavirus kit, and then I heard that those kits were not working properly. What are you doing really on the ground in hospitals to decipher if someone has the coronavirus versus the flu versus something else?
You know, interesting enough, I had a case the other day in the hospital, in the emergency department, where a patient presented who was traveling from out of the country. He had fever, he had cough, and the incubation period, the time that you can sort of have the coronavirus and show symptoms, is from day 2 to day 14. And he was at day 14. I spoke to the CDC, I spoke to the State Department, and we decided that the patient was not at risk for having the coronavirus. So we're identifying patients during triage, during the initial presentation in the emergency department. We ask questions as if there's any foreign travel, if there's anybody that they've been in contact with that they know that's been sick, so we can isolate those cases. As soon as we do, we quarantine them, we put them in a respiratory droplet room where the least of the spread of contamination is lessened. We all put face masks on as well to prevent the possibility of being sort of contaminated with the coronavirus, and then we take precautions. Now, the issue is that we're sitting off the testing itself is going to the CDC, which 6 days, so a person would have to be quarantined for days. We're still working on having the testing done locally at the city departments and the state health department, which would lessen the period of time to quarantine a person if we suspect that they have the quarantine virus. There has been some fault with the test itself, but the scientists are, of course, working on these issues, and hopefully they will be resolved soon, and we can do better, sophisticated testing closer and with a faster turnaround. Yeah,
Anjali, the doctor brings up a great point. You need to have speed when you're trying to determine whether or not someone has this virus, and then the steps to take thereafter. What are you hearing from U.S. health officials?
Well, I think what's important to remember about the announcement yesterday, about that very strong showing of the officials yesterday, is that this is something that they have been saying for a while, right? The World Health Organization has repeatedly said China's containment bought the world time to figure out how to deal with it. And so the way that the U.S. has really, used their flu pandemic strategy to kind of, detect cases in all these major cities, because that's where the biggest impact can be. And so I think that's important to remember. And if you heard Health and Human Services Secretary Alex Azar yesterday, he did mention that. So listen to what he had to say.
The immediate risk to the general American public remains low. But as we have warned, that has the potential to change quickly. There is now community transmission in a number of countries, including outside of Asia. That's deeply concerning, and community spread in other countries will make successful containment at our borders harder and harder.
So as you can hear, he's talking about really the global effort of what it is going to take, and that's what the U.S. health officials are working on now, is how do they preemptively quarantine and contain this virus.
All right. I know you're going to be following it for us. Anjali Kemlani, thank you. And our thanks to Dr. Samson Davis. Thanks for the work you're doing, and stay healthy. Thank you.
Hey, investors. Zach Guzman here. Are you interested in learning more about the markets and getting the latest financial news? Well, then click right here to subscribe to our Yahoo Finance YouTube channel. Get the latest up-to-the-minute market analysis, big interviews in the world of finance, and information on how to manage your money every day wherever you are.